Welcome back after a 2-week break, babe.
We're back. You ready?
Yep.
All right. So we just covered an 8-year period broken into 2 episodes. Our first one was kind of covering the timeline, life events. Second video delved into the emotions and what was going on throughout that time. And we left off at what we consider the beginning of Brian's mental health journey. When that was with him making a call to a suicide hotline. And that put us at the end of 2017. So that's where we're going to pick things up today. So we're at the end of 2017. Brian made a call to a suicide hotline for veterans and talked to someone for a little while that day. And that seemed to calm him down. How the timeline of how things went after that phone call is a little fuzzy, like how short or long those periods were between appointments and stuff like that. But I do remember Brian gave me the keys to the gun cabinet that day. I felt still pretty uncertain what I was supposed to do because I didn't talk to anyone. Do I stay home and keep an eye on him? Do I distract him? Do I just give him space? I didn't know what my role was there. Still kind of don't. But I think someone got in touch with him from the VA within the next day to start scheduling appointments and evaluations and that kind of thing, and get him into talk therapy. So at the beginning of things with the VA, Brian got a diagnosis. And this kind of, for me at least, turned things on their head. Because we'd been stumbling along for all these years, not knowing what we're dealing with. And so now we get a diagnosis and we have some terms to work with. And his diagnosis was post-traumatic stress disorder, or PTSD, panic anxiety disorder, and major depressive disorder. I honestly was a little surprised by this and a little dubious. We'd asked about PTSD a couple different times and been told, nope, that's not what you're dealing with. So what changed? Why now? It kind of seemed odd to me. But in some ways you kind of like, see, okay, we knew all along that's what we were dealing with. So there was that. Anxiety, that one explains some of the symptoms Brian had been dealing with for years. He had come back from one of his deployments and ended up at the ER because he had chest pains, and he ended up having to wear one of those halter things to keep track of his heart. And they said, well, it's not your heart, you're fine. So he had these pains that were unexplained, which those are panic attacks, correct? Yeah, so that's what he'd been dealing with for years and had no idea. And then there were other things throughout the years that, the anxiety kind of explained, his reluctance to go to certain things or do, let's go to this, big function. It's like, there's all these people, and, there was that anxiety was playing into some of that. The major depressive disorder, that one, I had no idea. I didn't have any experience with depression or what that looked like, how it might manifest, so that was a surprise to me. But the VA got him set up with a therapist at the local VA office. That took actually several months before they actually could see him for talk therapy. They also set him up with psychiatrists, and they were, I think, in California. So it was always via telehealth type things, so they could prescribe medications. All this stuff was happening in the next 3 to 4 year period on his journey. So they were happening simultaneously, overlapping, but I'm going to kind of talk about each piece a little bit separately here. So we'll start with talk therapy. That seemed to work reasonably well. Fits and starts because it takes some time and, got to build a relationship with therapists and all that. I would often get frustrated. I think Brian did too, because his therapists seemed to have to cancel more often than not. And so they were constantly rescheduling. And so he's supposed to be seen every week, every 2 weeks, whatever it was. And it would turn into a month, 6 weeks. And I think when you're opening up these boxes of emotions and traumas and all this kind of stuff, and then you're like, okay, I can make it until the next appointment, and then the next appointment gets pushed back and it gets pushed back. Like that's really hard. And I could definitely see how it affected Brian, and it affected the rest of us, just because he was struggling, and we're all trying to be mindful and helpful, but life goes on. We've got 5 kids, and it was hard. And it caused more anxiety and emotions with stuff coming out in therapy. But he was able to work through traumatic events, and he'd come home pretty wiped out from the session sometimes. And a new term to me, I think for you as well, was flooding. And I'm going to pause a minute and kind of define what that is, because I didn't know what that actually meant. Because there's lots of definitions of flooding, but this specifically is emotional flooding. And it's the body's response to being overly physiologically aroused by physical and emotional sensations. So when a person experiences too many emotions, their body may go into shutdown mode in order to reduce the feeling of overwhelm that comes with emotional flooding. This can look like oscillating between feelings, mentally withdrawing, or having fight or flight reaction. So that was from the internet. What that looks like from the outside, like to me and the kids, was his reactions would be unexpected or unprovoked. They'd be really intense, overwhelming, disorganized, and unpredictable. So that's what it looked like on the outside for the rest of us. So that was happening sometimes through this process of therapy. But overall, I think it was good. He would sometimes share what was discussed, some of the revelations that had happened in therapy, to help me understand where he was at, what was going on, and help bring me along through the process. It would leave him emotionally raw for several days, and things were getting better. Sometimes it was still hard just to give him the space he needed with everything going on in our house. And then, of course, there were changes in therapists. I think he had 4 different therapists during this 3-year period. And that's hard. That's hard for anyone, just because you've got to start all over again, building that relationship and figuring things out. But I overall appreciate that he had someone to take these struggles to, get outside advice, input, someone who hopefully understands better what he's dealing with. But otherwise, I felt pretty useless as far as in this process. After about 3 years of doing therapy, jumping with the different therapists and all that, he was asked by the therapist, "Why are you still in therapy?" And, from his perspective, what he said to me was that, he felt like there was still work to do and that he still didn't feel normal. And the therapist said, "Well, you're doing fine," and basically was dismissed. And that was kind of the end of talk therapy for you at that point.
Yep. I don't know the exact reasons behind why I was, as you say, dismissed. Picking up details from conversations and interactions at the clinic, I get the impression that there were a lot of veterans there, and a lot of them were worse off than I was, having more difficulties. And so it was a simple triage process. There's not enough mental health providers for the patient load.
Yeah. So that was kind of it for talk therapy, but that, I think, was over 3 years you ended up doing that. During that time, you were invited to attend a group, PTSD support group that met weekly. And I was hopeful for this, that he'd find some camaraderie with some others that understood him better. But my impression of how that ended up going was, it gave him a focus and a project to put his energy into to help some other people, and that was good, but it seemed like it ended up falling on his shoulders. Like, I think a therapist was supposed to be there kind of leading it, and they were kind of hit or miss, or whatever, and so it fell on his shoulder to lead it and kind of be there to help the other participants, but it didn't seem like there was anyone helping him, and ended up being more of a strain. And so that didn't, I think he maybe did that, I don't know, a year about. So it was not, I don't know that it was super useful for Brian.
There are good groups out there for PTSD survivors. Mine turned into a joke. It ended up being a bunch of old guys that worked together on post, wanted to get together and bitch and tell stories about bad drivers. And it ran 8 or 9 of the younger guys off, including me. I was one of the last ones to leave, but I just said to heck with it. It wasn't without benefit, though. I can't explain why or how, but going to group sessions, especially initially when there was all the hope and getting to know each other, and it hadn't turned into an old guy bitch session yet, opened up something inside of me that had been closed and helped get some of the darkness out. So didn't last long, wasn't a great experience, but it did help.
I didn't know that part. That's good.
Yeah. Hey, you.
Hi.
Yeah, one day, 2 or 3 sessions in, I got in my pickup and was going to start it and just broke down sobbing, crying, like just hyperventilating, and like, holy shit, I can't drive, what's going on with me? And called my therapist, and I just left a message. She called me back. I'm like, what the hell is going on? And she's like, it's okay, it's normal, and just take the time you need. And so, yep.
That's good.
Yeah.
So we'll talk about psychiatrists. I don't remember all the medications they put Brian on. They put him on several combinations, I think, over the period of time, try to deal with the anxiety and the depression and that kind of thing. And Brian would tell me what, okay, they've got me on this and this and this, and I wasn't writing it down. I wasn't tracking any of this. I, was letting him handle things. But, it had significant effects on him, good and bad. Brian's talked about how he felt on the medications. I know at some point he said it would give him space. So like something would happen and he would have space. He wouldn't immediately go into reaction mode. He had space to decide how he wanted to react. And so it did give him some time to relearn reactions and stuff like that. But he also felt blah all the time, like just never had really any emotions, good or bad, of any consequence. It just kind of stayed. This was calmer for all of us, and it was quite a change. It did have positive effect on the kids and I. We felt less tense, and that was good. And I think that was good for Brian as well, just bringing that stress level down for everybody. The not so good parts of working with the VA and medications was just that the VA would change his psychiatrist. I don't even know if they would tell him that they changed his psychiatrist, and then whoever it was would change how they prescribed medication. So one psychiatrist would be giving him a 2-month prescription, and the next one would, he'd get his refill and it'd be a 1 month prescription, but no one said anything of, hey, you have a new psychiatrist, we're changing how we're prescribing. And so he'd run out of medication before he was, because he didn't realize that they had changed something, which is terrible for VA, who is working with people who struggle with PTSD, and they should know that surprises like that are bad. And then it takes 7 to 14 days for medications to get to you. And so if you don't figure out that, they prescribe something differently, you might not get your medication in time before you run out, which on some of these drugs is awful. So that was, that seemed to cause a lot of anxiety. Like, as we were going through this process, it would happen again and again, and it was just, you never knew when it was going to happen, and it was a struggle. There was one medication that had side effects that Brian called and talked to the psychiatrist about, and the doctor said, okay, stop taking the medication. And I wasn't on the phone call, but, Brian came in and he said, well, they said to stop taking the medication. I checked to make sure, I didn't need to wean off of it, just stop it. And they said, yep, just stop taking the medication. And so he did. I don't remember what the medication was. And I don't remember if it was that next day or if it was like a 24-hour period from when he stopped, because I wasn't checking off, okay, did you take this medication? So I don't know exactly the time period, but within a short, like a day's time, things were bad. Things were really bad. I remember it was a Saturday morning and Brian was raging, which the reality is he was emotionally flooding. But what it looked like to the kids and I was he was in a rage, and it made no sense. It was bad. And there was a moment where I found myself walking away from my house to the neighbors, barefoot, just getting out of the house, because I didn't know what to do, and I was scared. And that was a really scary situation. I didn't make it to the neighbor's house. Brian ran out after me with shoes and a jacket and was no longer raging. And so we went back home to figure things out. What we didn't realize at that time, and we figured out later, was it was due to withdrawal from the medication, and he should not have just stopped taking that medication. And maybe there was a misunderstanding. Maybe what the doctor was trying to say, which Brian had mentioned later, that, yes, when the new medication comes, just stop taking this one and start taking the next one. But they didn't say that. And he even confirmed with them. And so these are things that I think would be really important, that a doctor make sure you understand what you're doing. Because it put our family and relationship in a really bad situation.
And unfortunately, that was not the last time that I would get bad prescription advice from a VA doc. Which is why I no longer get my prescriptions from the VA, and I pay for it all out of pocket through our family doc.
Yep.
On the last straw with the VA, I was so desperate that I called my family doc and was lucky to be able to talk to her and explained everything, and her response was, oh yeah, it happens all the time, we need to wean you off on a different schedule, and spelled it all out for me, and within a couple hours had a prescription for me. And like, this is not unique special information. This is stuff that a family practice doc who's 50 years old has known her whole career.
So needless to say, medications with the VA did not go real well. There were some positives, but overall it was not a great experience. So pause in the middle of all of the therapy stuff. Brian got a new job in May of 2019. So we've been doing this, recovery and working with therapy and all that for a couple of years now. And he got a job as an arborist, which really is a dream job for Brian. He loves trees. He's great with chainsaws and pruning and that kind of thing. Loves climbing. So, this was a wonderful fit. It was challenging, honest, hard work. It was fun for him. And it was really great to see him excited to go to work, see him energized and doing something new and learning. So there was that bright spot in there. That's a nice smile.
That's good.
So Brian's getting better slowly because these things don't happen overnight. The diagnosis was a start, but healing and recovery were slow. And I still lacked the understanding of what it all meant for me as the spouse. I'm his caregiver. But this term hadn't really crossed my mind of, hey, by the way, you're the caregiver of someone with PTSD. It's still, I had no idea really. He was on a journey to heal, and I was there for the ride, to support as best I could, is basically kind of how I felt. What it meant to me was just continue doing what I was already doing, caring for the kids, meals, household, all that kind of stuff, and try to be patient. There were parts of this, though, where I was really struggling with the new Brian. Things would be going along okay, but I was still holding on to and afraid that the whole thing would come crashing down if I let my guard down. Brian would remind me that he wasn't the same guy, the same angry guy from previous years. And I believed what he said, but years of managing life with him who would get angry pretty quickly, it's hard to stop doing. And I know that's been really frustrating for him. He'd be doing all this hard work, and it seemed like it didn't matter because I wasn't reacting any differently. My defenses would come up really fast. I was ready for, whatever fight was going to happen. So somewhere along the way, Brian suggested I might try going to therapy. Maybe I had secondary PTSD, or just to work through things of the past years. And I went to the VA clinic as well because they have programs for the spouses. And the first therapist I saw said, you don't need therapy. The second one went ahead and took me in. And I felt like I needed more information on what am I dealing with? What is PTSD? What is my role? How do I work with all this? So I can better communicate with him and not make things worse. And I don't feel like I really got that from anybody. I did get a book that we'll talk about at some point that is reasonably helpful. It's more helpful when you have time to read the whole thing. But beyond that, I didn't feel like I got much help from there. They encouraged me to go to the Spouses of Veterans with PTSD group that they had in the area, kind of like the support group that Brian went to. I found excuses not to go. I mean, they said I was welcome to bring my little one with me because I still had a infant toddler run around on my hip. But I still didn't feel like I could do things for myself. It was hard for me to go to therapy because I'd have to leave things, or I'd have to schedule it while I was at work. So when I had a sitter and all that, so I didn't leave things on Brian's shoulders. And so I never went to the support group, partially just because of those feelings and also how things kind of went for Brian. I was a little hesitant about all that. Through all this, Brian ended up stopping all medications through the VA, which meant he had to wean off of all these medications. So there's that period of withdrawal and, managing emotions and what was, mood swings and that kind of thing. And then figuring out how to manage without the medications now, as, something that's would usually cause him anger. You know, how is he going to respond now that he doesn't have the medication in there to slow things down or whatever.
What Alysia's talking about is I weaned off SSRI, SSNRIs, and the big dose of gabapentin they had me on, in concert with our family practice doc, and then I switched to Wellbutrin, which is a less potent antidepressant, and was on that for several years. So, but off of the more powerful stuff.
Yep. And he definitely had more coping skills to manage, but you know, dealing with the withdrawal and all that was definitely hard. It was a hard time for all of us. One other thing he did in his recovery and healing process was trauma release exercises. And he had a friend who was willing to work with him in this, and that seemed to be really helpful. That was also via Zoom, and so they asked me to be there to kind of help Brian in the room, and that was really interesting for me because the practitioner, she had such good intuition on how to help him when we'd come to a session and there would be something not quite right or he was struggling with, and so she would be able to kind of change gears and from the TRE and help him ground and work through whatever it was. And for me it was really inspiring and humbling because I never seemed to be able to do that. I'm like, well, how did she do that, you know? And so that gave me hope that, you know, there's possibilities that maybe I can learn how to help better. But that also seemed to be a really helpful tool for Brian.
TRE, if you're interested, look up the work of David Berceli. He's the guy that came up with the theory and the practice, and I can't say enough good things about it.
So we'll end with 2020. Everybody knows what happened in 2020. Luckily, Brian was able to work through COVID lockdowns and everything else because he was outside and that kind of thing. So that was really good for him because being home, trying to manage the school and the different devices and everything else was a bit chaotic and stressful for everybody. One kind of funny story in my head was Brian would often say, and still does sometimes, you know, he'd love to have 100 acres with a home in the middle so he didn't have to deal with people. So here we are in COVID, lockdown. They're encouraging people to stay away from each other. Okay, so we get our peace and quiet, if you will, you know, get to stay away. And Brian was the first one, like, calling up people, say, hey, you want to come over and we'll do dinner, we'll do it outside, and you know, we'll do these things. And said, as much as he grumbles about people, he really needs his community. He needs his people to just be there as support. And I think it was really important for all of us. Honestly, it was good for all of our mental health, but it did kind of strike me as funny that, you know, here we were and we were inviting people over. But so that was about 4 years of ups and downs with the mental health journey, which of course is still ongoing, but not doing as much of the therapy and all that kind of stuff now.
Good job.
Thanks.
All the lockdown prophets are going to be commenting on this video saying, you did what during the lockdowns? Thank you.
You're welcome.